Hey everybody, it's Professor Gould. We're going to start learning about the heart. And look, heart got some oxygen from lungs and says he's going to share it with everybody, which is of course the job of the heart, move stuff around the body so that oxygen and nutrients get to all of our cells, carbon dioxide gets taken away. So first, let's start off just, with the most basic stuff. Here's the thing. Your heart is actually located in the middle of your chest. As you can see in this diagram, it sticks out a little more to the left than to the right, but it's mostly behind the sternum, which is a big, strong bone that's there to protect your heart because, your heart's important. So you need to, protect your heart. So your heart is not behind your left boob. So when you're saying the Pledge of Allegiance, put your hand over the center of your chest, please, not your left boob. Thank you. Moving on. The heart is turned a little bit so that the right border is actually anterior to the left border. So the right side of the heart is actually a little bit in front. The base of the heart is this flat part that's kind of on the back and in the top. And then the superior border is actually made up by the space where blood vessels enter and leave the heart. The superior vena cava, the ascending aorta, and this one right here, the pulmonary trunk. The bottom of the heart is pointy and is called the apex. And then the inferior border of the heart is made by the wall of the right ventricle. Okay, this is all going to make more sense in a minute when I show you a cross-section through the heart. Now you may be wondering, why is the base of the heart over here kind of on the top and the apex definitely on the bottom? And that's because the heart is a triangle. The apex is the pointy bit and the flat bit is the base. Just like when you were in geometry class, I know you've forgotten all about it, but you learned the area of a triangle is the base times half the height. Ah, yes, the base is the flat part, the apex is the pointy bit. We're going to have several triangles in the body that have an apex at the bottom. So just be aware of that and know that that is indeed a thing. Now, this is a picture of a heart in the chest of a cadaver. So the bones have been taken away so we can see the heart. And you can see this part right here, this is the right ventricle. Here, where this blood vessel is where the left ventricle starts, and then the left ventricle is primarily on the back. This is the right atrium. I know it doesn't look anything like the right ventricle, and that is going to be important. And then we've got the aorta coming out here, the pulmonary trunk coming out here, and the superior vena cava coming in here. Okay? Notice the lungs. Not looking that great, but honestly, if you live in a city, your lungs probably don't look that great. We'll come back to the lungs later, don't worry. The heart is held in the chest cavity, in the thoracic cavity, by a sac. There's also sacs around the lungs. We're going to come back to those, obviously, when we do the lungs. But first, we're going to talk about this sac around the heart called the pericardium. Cardia means heart, peri means around, so the pericardium is literally goes around the heart. That's what its name means. It's actually two layers of epithelial tissue with a connective tissue layer around it and a tiny amount of water between those two layers of tissue. So you see here this dark line, that's actually the space that has a little bit of water and it holds, that water holds the two layers of tissue together. Remember that water molecules like to stick together. That's why straws work. That's why fluid has surface tension. And so when you put a thin layer of water between two layers of tissue, those two layers of tissue stick together. And that enables the heart to move within that sac without creating friction between those two layers because the fluid enables them to move smoothly. Okay, let's talk about this pericardium in a little more detail. The outer layer, is fibrous. Okay, it's made of dense, irregular connective tissue. And that is attached to the structures around the heart. It's attached to the pulmonary artery, pulmonary trunk, the aorta, and the diaphragm muscle on the bottom. So it's attached all the way around so that it really holds the heart very securely. It is an incredibly tough, strong layer of protection around the heart. Now the inner layer, this is the fibrous pericardium, and then the inner layer is the serous pericardium, and there are two layers to the serous pericardium. I know, confusing, so technically the whole thing is actually, I guess, 3 layers, but I'll only call it 2 layers. Anyway, imagine these 2 layers as a balloon that you smushed the heart into from the outside, and so the 2 layers of the balloon wrap around the heart. So the parietal layer is on the outside connected to this fibrous pericardium, and then the pericardial cavity is between, and the visceral layer is actually attached to the muscle of the heart. And it's actually called the epicardium. It has 2 names. It's the visceral layer of the serous pericardium, and it's actually also the epicardium. Okay, all right, so let me go through all these terms. All right, serous means a tissue layer, and it often refers to an epithelial tissue layer. So these layers are just a simple squamous epithelium. Okay, they're really, really thin. And that's both the parietal layer and the visceral layer. Parietal is going to refer to things that are not directly next to organs, and then visceral refers to the internal organs. So a visceral layer of anything is going to actually be attached to an internal organ. So hopefully all those terms make sense, okay? So we've got the fibrous pericardium, and then these 2 layers make up the serous pericardium. And the serous pericardium has a parietal layer and a visceral layer and a cavity between them that has fluid, and that fluid is actually secreted by the squamous cells in the serous pericardium. Now, if you get an infection in the pericardium, it is called pericarditis. Itis means infection. And it's problematic, not just because it will cause pain, because infections cause pain, but also because the immune response is going to bring more fluid and more white blood cells to the site of the infection. That's why if something is infected, it swells. Well, if you get more fluid within the pericardium, that's actually going to press on the heart. See, here's the thing. Remember, this is dense irregular connective tissue. Dense irregular connective tissue doesn't stretch. So the pericardium doesn't stretch around the heart. It holds the heart really, really strongly. So if you put a bunch of extra fluid in this pericardial cavity, it's actually going to push in on the heart and restrict the amount that the heart can expand when it's relaxing between heartbeats. That means the heart's not going to be able to accommodate as much blood, which is going to lead to fatigue and shortness of breath. And that's going to suck. So, pro tip, don't get pericarditis. Let's look at the rest of the wall of the heart before we go to look at the different structures of the heart. So the epicardium is the serous layer of the pericardium. And then there's also this layer that kind of looks like adipose. Of course it is. It's adipose and areolar connective tissue, both of those. Okay? That's called the epicardium. The next layer is called the myocardium. Myo means muscle. So whenever you see myo, think muscle. Myocardium, muscle, heart. This is the layer that's actually made up of heart muscle cells. Now, on this diagram, it looks like there's only heart muscle cells here. There are actually heart muscle cells and connective tissue that provide a fibrous skeleton that helps hold the heart in the correct shape. Just remember that that is there. It's primarily cardiac muscle. And then the inner inner layer is the endocardium. Remember, endo means inner. And this is again a layer of areolar connective tissue with simple squamous epithelium underneath it. Okay, so we've got a simple squamous epithelium on the superficial layer of the epicardium, a simple squamous epithelium on the inner layer. This is going to be facing the cavities of the heart, and an epithelium that's on the inside of something is often called an endothelium. So that's where that term comes from. So that is the structure of the heart wall. And remember, this is part of the pericardium, the visceral layer, then there's the parietal layer, and then there's the fibrous layer. And that is our introduction to the heart.